Tell you what, after years and years of lifting, playing sports, okay, just generally being a large dude, I'm staring down the barrel of a knee replacement sometime in the future, okay? And another reason why I decide to do so much exercise, so much recovery, and just try to take as best care of myself as possible is because I don't want to undergo that type of stuff, okay? I want to forestall that and push it off for as long as possible, okay? But you run the numbers here, hey man, the price you pay for being big, tall, strong, active dude. Oh well, 800,000 Americans undergo knee replacement surgery every single year. These exercises can speed up recovery and hopefully forestall it, okay? Because that's what ultimately I want to share that information out there. How about that? The knee is the largest joint in the body. Is it? Or would the hip be? Interesting. Okay. And years of wear and tear or injuries can cause severe damage to our knee joint to the point that our knee loses its functionality, and using it brings pain or even harm to our health. Like I'll tell you, okay, when I was not lifting as heavily as possible, when I was just doing much more cardio that was out there, I wasn't strengthening any of the additional tissue that surrounds the knee joint, my knees would hurt so bad a whole bunch of different times, okay? And that was also working in places with either uneven or concrete ground, okay? Running warehouse gigs, okay? Working in the oil patch, my knees would hurt constantly. And now I'm doing far more exercise. Okay, I'm standing more consistently. I can say that, okay? Because there were some security gigs that I was doing as well where I would stand for more hours consistently. But like even just doing this type of stuff, like I'm moving around and all that stuff, I've also acquired the understanding of how to properly stand and how to lift in order to mitigate the amount of pain that my knees would be under. Like I thankfully with the amount of stretching and recovery work that I do as well, on top of the lifts that I perform and don't perform anymore, I'd like to think I'm generally in good joint shape, okay? And I continue to touch wood on that one because I don't want to jinx that. According to an American Academy of Orthopedic Surgeons, AAOS, every year around 800,000 people in the United States undergo such surgery to replace the injured or worn out knee joints. And currently, over 90% of modern knee replacements are still functioning properly 15 years after the surgery. Well, that's good because it used to just be an entire butcher job that would happen. You'd have all of those steel gimmicks put in there and then they'd rub against one another. I understand that I'm going way back in the cut on this one. It's a lot more sophisticated now and you barely even notice it after a while. That's all what I hear, okay? I don't know anybody specific, I don't think I do, that has a knee replacement, and I'd like to keep it that way in order to, and that's why I want to acquire this information so I can help out the people that I care about, including myself. Knee replacement surgery is also known as total knee replacement and knee arthroplasty. Yeah, of course, surgery involves replacing a damaged, worn, or diseased knee joint with an artificial joint, a prosthetic. Yes, our knees can be severely damaged by arthritis or injury. Once this happens, we feel pain in our knees while running, walking, standing, sitting all the time. And they're sitting down or resting. Yes, there we go. In some cases, knee deformity may take place as a result of an injured knee. People of all ages can have knee replacement surgeries. Orthopedic surgeons recommend this procedure based on the patient's physical conditions, such as knee pain or knee function loss, instead of age or other factors. A potential candidate for knee arthroplasty would be someone who suffers from severe knee pain, chronic knee inflammation, swelling that cannot be cured by medicine or rest, knee deformity, as well as limited daily physical activities. Knee replacement operations are used as a last resort if all other medical treatment methods don't seem to work. Yeah, such as injections, okay, trying to round off the different heads, the femur, the tibia that ends up on there, okay, trying to artificially replace the meniscus that's in there. I know they're trying those different tools as well, and then obviously weight loss, getting less weight on those joints consistently, proper stretching, lifting techniques as well, all of that plays into account. But if you find yourself facing the barrel of the gun that is orthopedic, there's no arthropedic, that's not a word, orthopedic surgery, you should know what to expect. When performing a knee arthroplasty, it is not the entire joint that's being replaced, only the surface of the bones, the femur, patella, and tibia in the joints that are replaced. Therefore, the knee is actually resurfacing procedure. Yes, Exactly. It's like body work on the car. You're just sanding it down, replacing it with some other material, and then making it look flush and then painting over top of it. Very simplistic breakdown here. Step 1, removing all the damaged cartilage surfaces at the end of the femur and the tibia, as well as a small amount of bone. Replacing the removed cartilage and bones with metal implants, prosthetic devices, which can be cemented onto the bones. The metal implants are femoral component and tibial component. The femoral component is typically attached to the femur, and the tibial component is inserted into the tibia. Step 3, depending on individual cases, possible resurfacing the patella with a plastic button, or replacing or resurfacing. Okay, interesting. Inserting a medical grade plastic spacer between the components of the medical implants. The spacer is snapped into a tray on the tibial component, and the femoral component slides into it. The spacer ensures that the metal components glide smoothly when the patient moves. Yes, instead of just having metal on metal grind, and normally when you need a knee replacement, you have bone on bone grinding, and that sucks. So now you know what the knee replacement is. You might have had some idea about it where they just think, oh, hell, they just go in there with a whole body. They just put all the Bondo in there and they just make a new knee out of it. No, it's just more or less just scuffing up what's in there and making it function a little bit better. Now that that's clarified, what exercises can actually help speed up this process? Recovery for knee replacement surgery involves a period of physical therapy, and the duration of post-surgical recovery period depends on the individual patient's condition. A full recovery usually takes several months, however, typically at the 12 weeks of rehabilitation, so yeah, you're looking at 3 months there. Patients can perform most of the physical activities they enjoyed previously when they had healthy knees. Typically, orthopedic surgeons and physical therapists recommend their patients do 20 to 30 minutes of exercise per day, a walk for 30 minutes, 2 to 3 times per day in the early stages of post-surgical recovery. Depending on the stage of recovery, patients can choose certain exercises to help with their rehabilitation. So let's take a look what that is. So stage 1, 2 weeks after surgery, walking. Walking is an excellent exercise to improve the range of motion of the leg, which has been operated on. The best way to help with the knee recover. Patients can do this exercise throughout the recovery period and beyond. The goal is to walk independently 3 times a day. When walking, they can put as much weight as they want on their recovering leg, unless their doctor wants to set a limit on the weight. Sweet, good. So I think you know a thing or two about walking. Chances are I'm putting good faith out there to the audience. Ankle pumps. Okay, so lying down flat on your back and then rotating your ankle. Interesting. Ankle pumps exercise the lower leg, improve circulation, reduce blood clots, swelling. Okay, repeat 10 times, 1 set. Then walk around for an hour. Oh, yeah, in the waking hour until you return to normal activity. Okay, heel slides. Okay, yeah, again, trying to put the heel as close to your buttocks as possible while keeping the sole of your foot flat. You don't need to be using shoes on that one. Making it slide might actually hinder that process as well. If you can handle laying on a solid ground like linoleum, vinyl flooring, hardwood flooring as well, you can also just put like a cloth under your foot as well for ease of sliding as well. That might help as well. So yeah, heel sliding using the quads and glutes in order to facilitate movement. Obviously, that makes sense. 2 sets of 10, obviously, yeah. And you can do all of these while lying in bed as well. Quadricep sets, flexing quads while lying down as well. Toes pointed forward, okay. And then just flexing your quads. And how do you do that? By trying to press down and then flexing the front of your legs in order to maximize the use of isometric contractions in order to strengthen your quadriceps, because chances are, okay, like walking, oh sure, it's going to help a lot, but you're not exactly strengthening any of those additional stabilizer muscles that are going to help you maintain a healthy knee going forward. Supported knee bends, strengthening with a therapy ball. Yeah, exactly. Passive knee bends. So yeah, bringing them up to the hip and then bending them as well. Yeah, of course. All of that stuff you know as well. Seated knee extension. And then from the 3 to 6 weeks after surgery, straight leg raises. Yeah, 1 foot at a time. Or if you want to get a good ab exercise in there at the same time, you can just go ahead and do both and just put your hands behind your lower back and then kick to your heart's content if you'd like to. But again, it's probably a little advanced for most people undergoing a knee replacement surgery. Just saying, standing squats or squats with the chair. Yeah, bodyweight squats. Use a wall as well. Or just even still, you can go even more basic than that. Just get into a seated position with your back against the wall and then just hold it for 25-30 seconds. Repeat as necessary. Active knee bends and straightening. You can do that on a bed as well. Stationary bike riding, yeah, that requires an additional piece of equipment, but yeah, feel free to do that as well. 7 to 12 weeks after surgery, single leg balancing, as yeah, of course. I don't think I need to illustrate that or break that down. Front lunges, yes, of course, and properly do a lunge, okay, whatever your lead foot is, okay, make sure your knee doesn't go beyond the tip of your toes, because that additional stretching, yeah, that's not good. That's going to lead to more knee damage. Even if you have a healthy knee to begin with, don't be lunging like that. That's just stupid. And then for your back foot as well, however far back you can go, and then you can get on the ball of your foot. Simple as. Front lateral step ups, improve your back. Step up, stand facing a step, lift one leg up and down. Oh, okay, so go up the stairs. Cool. Wall squats. Hey, there we go. I recommended that beforehand. Instead of body weight squats, you can do the exact same thing. It all depends on your strength level. Okay, 12 weeks after surgery, full activity. Sweet. Oh yeah, long and short of it is, basically you want to make sure that you have proper running or proper walking technique in order to avoid needing that knee replacement to begin with. Make sure that you stand appropriately with a little bend in your knees so that you're not locking out your joints, putting all the additional pressure on those joints, because they're not as strong as those muscles. Your muscles are made to bear a load. Your joints are not. They're there for functionality, not for pressure. Standing whenever you're doing something with a slight bend in your knees, all your weight should be on your heels, and then distribute it out towards your toes, okay? But not a whole lot of weight out there as well. Feet hip distance apart, and then standing up straight so you aren't putting additional pressure on your lower back. You're not putting additional stress on your knees and hips either. But if you're going to be exercising, there's actually a picture at the top there. Yeah, I definitely don't think that this is bad, but just a little bit of a form critique. If I was to do as much, I wouldn't be going down that low. I wouldn't recommend anybody be going down that low, because again, your butt is lower than your knees, and you can also see them kind of folding in as well, and that's also very, very detrimental to your medial ligaments in your knee as well. So yeah, you can stop at a 90-degree bend in your knee because you're getting full use out of your quads and your glutes, which is what you're ultimately trying to train with the squat. But also, if you want to maintain healthy joints, don't deadlift. Deadlift is stupid. Only train deadlift if you want to get better at deadlift. I think I've said deadlift enough, so I'm just going to move along without even explaining that, because I can let professional strongmen like Brian Shaw, and Eddie Hall, and Robert Oberst just go ahead and repeat the exact same stuff. So I'll tell you that. You don't even need to take my word for it. But in case you do, there you are. That's my opinion on it. So with all that said, thank you all very much for the gift of your time. I've been Don Consuelo. I want you to follow your gut and get after it. Take care, everyone.